Thank you for joining the wellness program at Duren's Pharmacy. Today our discussion is titled The Medicine Cabinet, Treating Diabetes. The topics we will cover today include a review of the goals for blood sugar. We will also discuss the different types of medications used to treat high blood sugar, how each family of medications work, and possible side effects. Let's review the blood sugar goals. A fasting blood sugar is taken after you have not had anything to eat or drink in the past 8 to 12 hours. A fasting blood sugar should be between 70 to 130. The postprandial glucose is taken 1 to 2 hours after the start of a meal. The postprandial glucose should be less than 180. In type 2 diabetes, either your body does not produce enough insulin or your cells ignore the insulin that is produced. Diabetes medications work in 4 different ways to treat these problems. They can stimulate your pancreas to produce and release more insulin into your body. They can inhibit the production and release of glucose from your liver. They can block the work of the stomach enzymes that break down carbohydrates from the food you eat, and they can also improve the sensitivity of the cells in your body to insulin. Let's start out talking about the pancreas helpers. The first family of medicines we will discuss is the sulfonylureas. This category of medicines is one of the oldest used to treat diabetes. They were first used in the 1950s and were the only medicines available for diabetes until 1995. Sulfonylureas work quickly. They stimulate the release of insulin from the pancreas. They are more likely to cause hypoglycemia than many of the other medicines. One drawback of these is that over several years they may become less effective or stop working completely. These medicines are taken once or twice daily. They are safe for most people. However, if you drink alcohol, make sure your healthcare provider and pharmacist know. It can be a problem with these medicines. The next family of pancreas helpers we will talk about is the amylin mimetics. This medicine is a synthetic, lab-produced hormone that stimulates your pancreas to release insulin. It is injected just before a meal. That's the bad news. The good news is that it can suppress hunger and promote weight loss. Side effects include hypoglycemia, headache, and nausea. Similac can be used along with insulin injections to achieve blood sugar control. The last of the pancreas helpers we will discuss are the meglitinides. These medicines work quickly to stimulate your pancreas to release insulin, but only when there is glucose in your blood. Insulin will only be released if your blood sugar is high. It is taken 15 to 30 minutes before meals. It can cause hypoglycemia, weight gain, nausea, and headache. Now, let's talk about the liver helpers. Biguanides keep your liver from releasing glucose into the blood. They also improve the ability of insulin to move sugar into your muscle cells. This medicine is usually taken 2 to 3 times daily, but if the side effect of diarrhea and nausea are a problem, the metformin XR or extended release may be taken once daily to reduce these problems. This is the most commonly used medication for the treatment of diabetes and has very little risk of hypoglycemia when it is used alone. It can also have a desirable side effect of weight loss and a decrease in the LDL cholesterol. You should not take metformin if you have kidney disease or heart failure. The next medication that we will discuss for the liver helpers is the thiazolidinediones or TZDs. This is another difficult name to remember, but I bet you will recognize the brand names of Avandia and Actos. These medicines improve the sensitivity of the muscle and fat cells to insulin, and they inhibit the release of glucose from the liver. Side effects can be severe, and there are strict prescribing recommendations. Actos is still available at any pharmacy. Avandia, however, is only available through the mail order from the company that makes Avandia. If you take either of these medicines and you have concerns, please talk to your doctor or the pharmacist for more information. The last of the liver helpers are the DPP-4 inhibitors. This category slows the release of glucose from the liver and stimulates the release of insulin from the pancreas. They don't cause weight gain like some of the medicines. They can be used in combination with other medicines as well and are taken only once a day. Your prescriber may need to make adjustments or use Tradjenta if you have kidney disease. Now, let's move on to the stomach helpers. At the stomach and intestines, the food you eat is absorbed as starch. These medicines can help to slow down the breakdown of starch and some sugars. These medicines are sometimes referred to as starch blockers. They need to be taken with the first bite of each meal. They are usually used with other medicines to control your blood sugar levels. They do not cause weight gain, but you may have some stomach pain, gas, or diarrhea as a side effect. This group of medications is called the alpha-glucosidase inhibitors and includes the brand names Precose and Glycet. The next family of stomach helpers we will discuss are the incretin mimetics. This small group of medicines are injected either daily, twice daily, or weekly. They slow down digestion so that sugar enters your bloodstream more slowly. They also stimulate the release of insulin. They may suppress hunger and promote weight loss by helping you to feel full longer. Most often, they are used with other medicines like metformin or sulfonylurea. The side effects are usually nausea or headache. These medicines should be used with caution if you have kidney disease. I know that was a lot of information and some very hard names to remember. Each one of you may take a different combination of medicines and dosages. Please ask us about your medicines. Doctors, pharmacists, and other healthcare providers have spent a lot of time learning all of this complicated stuff. We can make it easier for you to understand and remember. Just take a little time to ask us for help. As you can imagine, you have to take your prescriptions for them to work. Sounds simple, but many folks just don't do it. Ask why, when, and how every time you get a prescription filled. If you understand why you need to take the medicine and know how it works, you are more likely to take them. Set up a schedule for your medicines and stick to it. There are many boxes, containers, alarms, and other ways to make sure you don't forget. Remember to ask how to take your medicines. Is it a pill, a liquid, or an injection? Should it be taken with food or not with food? Can I chew it up or crush it if it's too big to swallow? But what if I forget to take my medicine? There will be a time that you do forget to take your medicine. Don't just skip it or double up on the next dose. Every medicine is different. Ask the pharmacist when you pick up your medicines and read the information that comes with your prescription. Some things can be taken as soon as you remember, others may need to be skipped. Don't be shy or embarrassed to ask about cost. Many medicines cost a lot or are not covered by your prescription plan. Talk to your healthcare provider first. Ask for samples, rebates, or special offers available from the company. Then ask to talk to your pharmacist. Ask about generic versus brand name, other comparable medicines that may be substituted, and special offers available at the pharmacy. Many drug companies have programs to assist patients with cost. If you can't afford to buy your medicine, you need to tell your healthcare provider so that something else can be prescribed. No matter how well a medication can work, it does no good if you do not take it. Any medicine you take has the potential to cause a side effect. Some are just bothersome, some may go away with time, but some are serious. Talk to the pharmacist to find out what you should watch for. Each medicine is different and each person is different. Make sure you know which side effects that you should be reporting immediately, like severe shortness of breath, swelling in the face or tongue, confusion, fainting, or chest pain. Other side effects like nausea, a metallic taste in your mouth, or a mild headache can be monitored at home. Keep a record of the medicines you take and write down any side effects that you might experience. Talk to your pharmacist or healthcare provider. Many times the side effects can be minimized simply by taking the medicine with food or at a different time of day. Don't be afraid of change. It is quite common for diabetics to have changes in their medicines and dosages. The way your body responds to medicine can change over time. Sometimes you just need to adjust the dose up or down. Other times you may need to change to a different medicine. There is also the possibility that a new medication may be better for you than what you are currently taking. Remember, the goal is to keep your blood sugar level within your target range. Be patient and work with your healthcare provider and pharmacist to do what you need to do in order to keep you healthy. Be on the lookout for our final video. Next week's video is called The Medicine Cabinet, Treating High Cholesterol. We will take a look at medications used to treat high LDL, high triglycerides, and low HDL cholesterol. Don't forget to stop by the pharmacy for a blood pressure check sometime this week. Contact Macon Carroll, pharmacist at Duren's Pharmacy, if you have any questions or need assistance with your medications. You are invited to join us at our monthly Sweet Spot meetings. We meet the last Tuesday of every month at 7 p.m. at the pharmacy. Bring a friend and join us as we learn about diabetes. Thank you and have a wonderful week. A special thanks is extended to Dr. David Pope at Creative Pharmacist for allowing Duren's to use the Sweet Spot resources for this presentation.